Hi, I'm Joanne Conroy, President and CEO of Dartmouth Health, and I am pleased today to be joined by Dr. Terry Malcolm. Terry recently joined Dartmouth Health as our new Vice President of Diversity, Equity, Inclusion, and Belonging. Welcome, Terry.
Thank you. Pleasure to be here.
Yeah, it's great to have you. Let's start out with just a little bit of your background so we can actually introduce you to the Dartmouth Health community.
Well, it's been a lot of fun, really getting to know people over these past 5 months. And my background, my clinical background, is as a board certified obstetrician and gynecologist. And prior to joining Dartmouth Health, I was partnering with healthcare organizations to help advance and enhance their DEIB initiative. So helping them with challenging norms and creating a culture of inclusivity and improving our clinical effectiveness. So it's just really exciting to be here now with Dartmouth Health and partnering with everybody here.
So talk a little bit about how you got interested in this field of leadership, because there are a lot of leadership opportunities, and I'm sure you were a busy obstetrician. And but was this something that happened in your experience, or was this something that you were passionate about that made you really consider moving into a leadership role?
Yeah. You know, it's really always been a passion of mine to create opportunities for everybody so that everyone really feels that their voice can be heard and that they are part of the work that we're being asked to do. But I think a real pivotal moment for me was when I was appointed as a chief medical officer and to be part of an all-female team, and what just a really exciting time that was. And at the same time looking around and realizing that I was the only woman of color, and knowing there's so many other extremely talented, courageous, ambitious individuals who just haven't been given the access or who have not been given the opportunity. And that's when I just really knew that it was my responsibility. I mean, I think I kind of had an inkling already, but it just really crystallized, that moment crystallized it for me, that I have a responsibility to open up the doors for others, because I know I did not achieve any of the success that I've been blessed to achieve thus far in my life by doing it alone. It really took a village. It was because of other trailblazers who came before me, who allowed for me to be where I am today. And so I'm really thinking about the legacy that we are creating. I'm thinking about the future generations and how important it is for us to constantly be thinking about how can we create greater access, how can we create more fair and equitable practices for everybody.
You know, we've talked about this before, but you come from a family that's actually very committed to public service. How about your parents, the impact that they had on your career choices? Because your parents have spent their lives trying to improve opportunities for everybody else.
That's so true, and I can't even begin to underscore how much my parents have been the ultimate role models in my life for me, and how they really have just set examples through their actions and through their behaviors, and taught me so much about integrity and character and courage and justice, and really utilizing everything that you have in service to others. They've given a lot for me. I am the first in the family to become a physician, and am frequently reminded that it was a decision that I made very early on, and that my parents always stood not just behind me, but always stood with me, and always said that we would be here for you. And I hope that I'm doing the same with our children. My husband and I are very fortunate to be the parents of 3 academic athletes, as we call them, and so that's the same kind of example that we're trying to set for them as well. So leadership, I hope it's just part of my DNA, because I come from a family of leaders.
Yeah, you do, and very impressive as well. One question about how we phrase the role. Most people call it diversity and equity, or diversity, equity, and inclusion. But we've decided to frame the work diversity, equity, inclusion, and belonging. So how did you find that when you first interviewed for the job? did that strike you as odd, or did it somehow have some level of resonance with you?
Yeah, it was definitely the latter. It was absolutely, it was intriguing, and it led me to lean in more and to really understand, so what is belonging here at Dartmouth Health? How are you interpreting this? How are you defining this? And what is going to be important to you as an organization in terms of bringing that forward? There's a lot of different ways to to really structure DE&I, and it's ultimately about what works for an organization. And what I'm learning from conversations and listening tours really here at Dartmouth Health is that we think it's extremely important for our employees, for our staff, for our patients to feel that who they are is respected, that they can come to work every day, that they can come to their clinic, their chosen clinic or hospital or ambulatory site, and know that who they are will be honored, that they can bring their true and their authentic self without having to cover up, without having to fear any type of shame or to fear any judgment around how they want to be respected and how they identify themselves. And when we can really create that kind of environment where we know that our authentic selves can come to work every day, this organization is going to flourish beyond levels that I don't think we can even really possibly imagine. It's just our ability to be able to tap into all of that talent and all of that creativity. It's going to just take us on a completely different direction than we've been before.
Yeah, and I would say from our employee engagement as well as our employee forums, belonging and diversity, equity, inclusion are top priorities for them. I think I've read some statistics that 60% of women and 40% of men actually do not bring their authentic self to work. And we need to change that, because I agree with you, it will unleash all types of potential from our employees that are kind of keeping their cards close to their chest right now, and we would like them to be able to lay them right on the table and be their authentic selves.
Yeah, it's so correct. And I think about if anybody were to ever ask me to not bring all of myself to work and just pose the question is, could you just leave maybe 30% of who you are back at home? I wouldn't even know where to begin. And I think most of us would probably be really stumped about that. But the fact that any of our employees, any of our patients that are from historically marginalized groups have to go through any type of mental calculations about what part of myself can I share? Can I share what I did over the weekend? Can I share who I go home to? Can I share who I love? Can I share how I like to spend my free time? And not be able to bring that forth, it really holds the individual back and ultimately holds the team back, the department, and then the organization back.
I absolutely agree. Now, I do want to remind our viewers that if you have a question, please comment on this video. We've got somebody looking at the feed, and they will magically appear on my iPad, so I can ask Terry the questions. Then we do have a few questions that actually were submitted ahead of time. What have you learned in your DEIB journey? So you've been here for 3 months?
5 months.
5
It's just
months.
been 5 months.
It flies.
I know.
Time flies.
I know.
What have you learned on the initial part of the journey? And what are your initial observations?
Yeah, well, I continue to learn. So the learning process has definitely not stopped. I'm learning how much the organization really is committed to DE&IB being integral to what we do, to our strategic planning, and it really becoming a part of our everyday lives. I'm learning how much our people really care and how much they want to get involved and how much they want to be engaged. And I'm learning about the challenges that we have. Some of the really exciting highlights that we have is about seeing women in senior leadership roles, that we have a level of commitment within the organization, that we have active and growing employee resource groups, that our employees have also told us in the DEIB survey that they feel comfortable coming forth with new ideas and at times challenging the existing norms that present. And at the same time, we know that when we slice the data, even down by demographics, that's not the same experience for everybody. And so men experience the organization differently than women do. People who identify as white experience this organization differently than people of color. Those are some of the gaps that I really am excited about working together with and helping us to close, so that it's a similar experience and that we see that there is fairness and that there is equity across the organization.
Yeah, it's interesting. My sister-in-law actually worked in investment banking in New York, and 20, 30 years ago, there were actually dress codes according to certain investment banks. I think there's one well-known one that, all women had to wear black suits and black flat skirts. And I think she had, 5 different shades of essentially the same lipstick. And it was kind of the uniform that women wore. Women didn't wear slacks. I mean, it was crazy just 30 years ago in investment banking. And those are some of the boxes that sometimes people get put in. And we probably have boxes in healthcare, but they're a little less visible.
Right.
It's not just a dress code issue or a unwritten rule issue, but it's something about what we do or don't do in the environment, and we just have to learn to kind of appreciate that diversity actually makes us a stronger organization. A lot of people say, let's do a study, and I don't think I could stand one more study about the impact of diversity, because let me tell the audience, there are hundreds of studies over the last 15 years that demonstrate when you have a diverse workforce, you make better decisions. We know that in business. We know that organizations have diverse leadership actually perform better financially. They make better decisions throughout the organization. Healthcare has just been a little bit slower to figure out how to incorporate that into how they do their business. So.
Yeah, we have some catching up to do, and and that's okay. It's one of the first steps is really acknowledging where you're at and what your starting point is, and to add to your point about really what the importance of diversity is in the organization. We're here to take it a step further, and we're really here to make that diversity work for the betterment of the organization, for the betterment of the communities. Inclusion is a choice. It's a decision, it's a conscious decision that you make to actually involve and engage and include other people and allow for their voices to be heard. And that's what we're here to do. So we're not looking for tokenism, we're not looking to check a box, but we're really here to work together with our community members, with groups within the organization to actually tell us what's going to work better for you, because I truly believe that those at the front line know what works best. We just have to create that channel that allows for them to do so.
Yeah, I did notice that you are involved in several of our executive searches to actually help us make sure that our pool of candidates is as diverse as possible, because we know that's where you start, to make sure that you work hard to get a significant pool of very talented people that come from all different backgrounds in order to select the future leadership of the organization.
Absolutely. And we know representation matters. So we know the more that our executive leaders, our senior leaderships can be reflective of the communities that we serve, it will continue to attract more of that diverse talent pool that we're looking for. So representation really makes a very big difference, because that then some of your ideas, that some of your experiences and your backgrounds will be represented in the decision making.
Let me go to another question. There sometimes is a belief that the commitment to DEIB conflicts with a commitment to excellence, i.e. you have to lower our standards. How do you describe the relationship between DEIB and excellence?
A commitment to excellence is really about a pledge to commit yourself to improvement. It's really about a commitment to making mistakes and learning from those mistakes, to constantly engaging in new ideas, new concepts, to working well with other people and asking them to contribute in a way that is really reflective of what their talents and what their strengths are. It's, it's just really about saying, I don't know it all, right? It's coming with a sense of humility to a new project and saying, I know I don't know it all, but I'm here to learn and I'm here to listen. And what I learn, I'm now going to integrate into the actions and the behaviors and make this and spread the word and honestly share it with others as well. I don't see how DEIB takes us away from continuing to do all of that.
Yeah.
And it's really not something that's separate from. It's actually something that is part of. So it's about us now weaving DEIB into the fabric of our community. And I don't see how it's any different and how it takes us away from our commitment to excellence already. I think it's something that's going to enhance.
Yeah, I agree. A question from the viewers: what role would our employees take in enriching our journey? And I think they are referring to some of our frontline staff. How can they be integrated into this journey?
You know, the success of this journey is dependent upon all of us. This is not the work of any one person, one department, one small group of individuals. It really is going to require all of us to challenge what we've been doing, sometimes just out of routine and just sometimes out of convenience. It's going to require us to be courageous at times where we're really fearful, right? When we're really a little intimidated and scared at times, and it's going to really require us to get comfortable with being uncomfortable. So there is an opportunity at every level for our employees to get involved and to get engaged. We can just start with conversations. I think we're moving from a place of awareness to action, and so I think it's going to be important for us to start talking about DEIB just in the same way. Like, that's my dream, is that one day we are talking about DE&I as seamlessly and effortlessly as we talk about quality. Because now we're at a place where quality is just part of what we do. We don't even question it. DE&IB can just be part of what we do every day. So there are plenty of opportunities for our employees to get involved, and it does really start also by looking within, and it's kind of taking a look at what am I doing within my immediate sphere of influence to create an environment where others feel that their voices can be heard. And it just can be as simple as asking somebody, so what's your thought about this new project that we're launching, or what's your thought about how we are operating currently, and taking that input into consideration and working together with others to say, okay, how can we make this even better?
Yeah. I loved when we were talking about the communication that we're having about kind of launching the strategic plan around DEIB. And there were 4 tenets to that. One of the tenets was social justice, which I think people don't appreciate how important a part of DEIB that is, acknowledging that and actually living it. I would say that that's something that resonates probably with a lot of our employees, specifically given the field that we're coming from, that I don't think you always go into healthcare without a commitment to social justice, because the best healthcare systems deliver care equitably to everybody, and there is an element of a social justice. I know we don't want to get ahead of ourselves because we are releasing something, but can you talk a little bit about what employees can expect over the next month or so in terms of where we're going in our DEIB journey?
Yeah. So we will be coming forward with more details about what our strategic plan is. So starting to sharing those, 4 core principles, those tenets that you just mentioned. And of course, more specific details about how our employees can get involved and what their responsibility is going to be in the success of all of this work. So it's really going to be coming forward with a whole description, which I hope that our employees will see this as a storybook of sorts, that they really want to sit down and read and share with one another, because it does outline where we've started, where we are, and where we're going. And so I think it really shares what our vision is for the future, and how everyone can get involved and be engaged in this work. So I'm really excited about that coming forward, because that's what a big part of what attracted me to the organization was the ability to co-create, and that's what this has been. This has been a very collaborative, co-creative process.
It's been a little bit of a journey. I think we started the process over a year and a half ago with a task force, and then utilizing some outside resources that help pull together a strategic framework. And you've been putting a lot of detail into that, and we'll be launching it. When we think across the health system, aside from the academic medical center, where we have a lot of our employees, this is their place of work. However, we have a lot of employees in the South and in our critical access hospitals and hospitals in Keene and practices in Bennington, Vermont. How do you plan on actually reaching all of these kind of disparate sites? Because we're not just concentrated here at the Academic Medical Center.
Yeah, we are definitely more than one site, and it is important that all of our employees and all of our sites do feel engaged in this work. We have employees that are entirely remote, and also who just because of their responsibilities and because of our desire to find more talent outside of the immediate area, will not come to New Hampshire, will not come to Vermont. They will provide all of their work from the remote destination. So, this is a big, heavy lift. There's going to be a lot of continued listening about what's working for our employees, no matter where they're at. We know that part of our strategic plan will have to be customized. So we'll have a system-wide plan, and then the ask is going to be for all of our member sites to take a look at that and see what works best within their community. This is not a one-size-fits-all, so this isn't like going to a fair and just winning a t-shirt, and no matter what size you are, that's the t-shirt that you have to wear. It's important that all of our employees really do feel that their voice can be heard and that their work can contribute to this. So even as we present and as we launch what our strategic plan is going to be, we know we're going to modify. We're constantly going to make adjustments, and because we're going to evolve. We are not interested in just doing one thing and stopping at that point. So this is a great roadmap that is not going to provide that turn-by-turn direction, but it's going to provide you, I think, the lanes that we need to move in the right direction.
I actually had not considered that, rolling out a DEIB program for remote workers, of which we have 2,500 in over 30 states. So, fascinating. So we have a lot of work ahead of us. What are you most excited to bring forward next month?
Well, definitely launching the strategic plan. That's really exciting. I'm also really excited about some of the work that we're doing around revising our policies. That we're taking a look at, are our policies really inclusive? And you mentioned about kind of old dress code policies from the banking industry. Well, we have some old policies here within Dartmouth Health that are not really reflective of the population that we serve, and most certainly not reflective of our employees currently, of the diversity that exists within our workforce. So it's really exciting to take a look at some of those policies, do some revisions, updating to those, continuing to really talk to our employees and to hear about what is important to them. We do have over 13,000 employees, so it's we know it's impossible to speak to everybody one-on-one, but I just wanted to highlight one conversation that I had just last week with one of our advanced practice providers, so Dorothy Mullaney, who works at DHMC, and just chatting with her about why this work is important to her. And it was very inspiring to me to hear her say that this work impacts everybody in a positive way. And to hear our employees recognize that this is work that's really intended to make a positive difference in our lives is what gets me excited every day, is that when we know that someone is that your work environment is going to be better, that you feel that you can come to work and bring your whole self to work every day. That's what I think about when I wake up, and that's what I think about when I fall asleep at night. And so it's continuing to have some of these one-on-one, some of these groups, some of these larger town hall conversations with our employees about what really matters to you, and then incorporating that into our policies and incorporating that into our work practices.
Yeah. Now, I've been not doing my job because I haven't read all of these questions that are coming in now. Yeah. There's a question about specific efforts to improve inclusion for the disabled community.
Yeah.
What are your thoughts on that?
Yeah, that's going to be another area of work that we have to look at. And the other piece around, with disability, it's not always the disabilities that are visible. It's the invisible disabilities as well that we really need to think about. So when we keep inclusion at our forefront, when we keep equitable practices at our forefront, it will take into consideration those special needs that, and I don't want to say even special needs, but I'll just say the needs that our disabled community is asking for and is really requesting as well. So something like a dress code policy, we need to ensure that we don't enforce something that would exclude anybody or that requires people to ask for special assistance or special accommodations for. Those are just the little things that will make a huge difference to somebody's experience and their work experience every day.
Yeah, you're absolutely right. Another question about military employee resource groups. How would that fit into overall DEIB efforts?
We have a military ERG, and it's wonderful that that group has grown as it has, and that we have individuals here who have given their life to serve our country and have a sense of community amongst themselves. So our employee resource groups and the Affinity and Belonging Council is a great opportunity for all of our employees really to get involved, but especially for our employees who are looking for a unique identity, who are looking for a unique way to connect and to bond with other people who share in their experience.
The final question is, we like to talk of ourselves as being of the community and woven into the fabric of community. What are we doing with people outside of Dartmouth Health that are important community members to further the DEIB efforts across the region?
Yeah, we're partnering with businesses. We're partnering with some of the bigger businesses as well as the smaller businesses. And I think that's where we probably have some of the greatest opportunity is really in partnering with some of our smaller, maybe single-owned and definitely minority-owned businesses to show them to show them really how significant our commitment is and how much we really stand by our words. I think there's a great opportunity for us to find more talent within those smaller businesses because of the connections that we have. And so we know that we've got to get out into the community. There's a whole area of untapped resources and gifts. So that's going to be another part of this work.
Yeah, I think they're eager to talk to us about this. So it's something that no one institution, no matter how well organized or funded, can do alone.
No,
we have to do it with partners. So I want to thank you, Terry, and I look forward to working with you as you further the DEIB efforts here at Dartmouth Health, and look forward to having you back on Connect with the CEO so we can talk more about how we're going to make the organization and the environment a better place for every single one of our employees to work. So thank you, Terry.
Thank you.